The method for assessing, we use the
ABC.
method for assessment. Number A is anthropometry data. That one is the one you can measure from the patient, isn't it? So in that data we have the weight, we have the height, we have the mark, we have Z-score is when we have gotten this Z-score and Z-score plus or BMI, body mass index, isn't it? So, but body mass index is from children 6 years and above. So Z-score from children 59 months and below, isn't it? So that is one. Then two, we have biomedical data. Biomedical data, bio mean now. Self, just like self. Of which the thing which we will dwell on here, it is the diet. Mostly we will dwell on the diet. How many times does the baby eat in a day, or the person eats in a day? What does the person eat? See? And then see, we have chemical. We are going to do CBC. Do you know that anemia is also malnutrition? Yes, we do look at the HB level. We can just do HB estimation, and then we are going to do electrolyte. Under chemical. So all these ones will guide us to the manage the person accordingly. But in history, there are very many things which we take. In history, first we will do the name, sex, age, like the name, the age, the sex, all the biographic data is needed. And
in the first age,
that is personal. Anthropometry is when you just measure. The one you measure and you use the mark, you use the Z-score.
Then about this one, the age, the name, the sex.
That is the mother also. You ask how many children the mother has taken, the level of education, because the knowledge about malnutrition, as the mother stop in primary, secondary, or higher level. And then marital status, is the mother single, widow, or the mother is divorced, the parent. So we have the bio data, we have the parity of the mother of the child, we have the marital status of the and then we have the living situation. How many are they living in the household? You know, very many. Some people have extended family, and then if go to the level of education, how can they afford to sustain the family, or they afford through digging and the rest of the thing. And then we go to who is aiding the household. Going back to the marital status, anyway, they can be married, but you find all the responsibility. Maybe the woman is the one carrying out all the house or activities. And then what do we go and look at? Water. The water let's go down the sanitation, hygiene, water. The reason why hygiene and water, hygiene mostly good, clean drinking water is good because of the worms and the disease which comes in from this water. Worm can cause anemia. Do you believe that?
Yes, because they suck.
And after that, what happened? Child need to be admitted or the person need to be admitted. And then where do they usually do to the water if they have got water? Still goes under sanitation. Do they boil, filter, or they just get and they just drink like ours here? Clean water.
But ours is plain.
So, all these things guide you to see what is the best management for your child or your patients. So, after all your history, your management will now based on what you have got. But I know other information you will never ever be correct. I ask if someone asks you, will you tell if the person has divorced the husband, will you tell you first go and remarry? So those one is a social thing. You need to involve those social workers and they see how they can handle or advise the mother generating source of income if the mother can be willing to adopt. So even the reason why you always take the age, because like a woman, pregnant women, young girls being impregnated, they are not able to first depend on their own. To first adapt to the situation of parenting. That's the most difficult thing. So that is all about assessment.